Well, a Toronto family physician wants doctors to know how much drugs will cost a patient before they prescribe them. Right now, you typically won't find out how much your prescription will cost until the pharmacist hands you the medicine. So Dr. Iris Garfinkel is calling on the Ontario government to mandate the inclusion of drug costs in electronic medical records. That way, doctors can prescribe a drug they know a patient will be able to afford. So Dr. Garfinkel joins us in studio this morning. Thanks for being here.
Thank you for having me.
Doctor, how have you seen patients affected by the fact that they don't know how much their drugs are going to cost?
As a GP, patients are profoundly affected by it on a daily basis. If I don't discuss it with them, I learn later with a call from the pharmacy that patients can either not afford it or their copayment from their insurance is simply too high.
So they just go without it? They come back to you? What are you seeing?
I'm forced to try to find a substitute, and that's difficult to do when I myself am not aware of drug costs.
So I was amazed to see an Angus Reid survey showing that 3.5 million Canadians cannot afford their prescriptions. People cutting food, heat, transport to pay for some of those drugs. Do you think that is directly related to doctors not knowing the cost up front? Or do you think that I think people wonder if doctors are in bed with Big Pharma as well.
The impact of doctors not knowing drug costs is massive. It's massive. And even when patients can't afford a drug, I would argue that they have the right to know what options there are. Are they getting the most cost-effective medicine? Mm-hmm. Doctors are ultimately stewards of a system which requires sustainability, affordability. So I don't think that doctors are in bed with pharma. I think that represents, if it exists at all, a very small part. The vast majority of prescribing is not that way. But a lot of prescriptions are given just because doctors don't know the costs. It's easy to do, and that's what comes to mind. And that's dangerous prescribing.
Well, we know that the Ontario Medical Association supports this. The Nurse Practitioners of Ontario support this, and Ontario Pharmacists Association also backing this. But there's a holdup at the government level. So we reached out to the Ontario Ministry of Health and Long-Term Care. Here's what they had to say. They said they acknowledge that you, Dr. Iris, have met with the Ministry of Health staff, including the ministry's Digital Health Secretariat, to discuss this opportunity. And the ministry is considering next steps. I mean, what do you think about this? What is the holdup on something that seems so simple?
It is so simple, and it's actually costs very little to institute. They should definitely mandate that drug costs show up automatically when the prescription is written on the electronic medical record. What's holding it up is one thing. That's the way we've always done things, and that's a poor excuse, but if you look back 50 years, doctors have long been ignorant of drug costs, and that's a simple, cheap thing to change. Give you the prescription, tell you the cost.
I think about the election coming up. I mean, that may be part of it, but what is the feedback that you're getting from talking to ministry officials?
It's interesting because everybody is on board with it. Everybody readily acknowledges the importance of this. Okay. And yet, there's a tremendous inertia to change, a tremendous inertia. And I think if we as a population say, this is unacceptable, our doctors have to know costs. If we're to have national pharmacare, that's especially important. Doctors can't give a drug that does the same thing that costs 10 times the amount. We have to change that.
Now, the ministry pointed out that Ontario drug benefit formulary prices are available on their website. So we typed in amoxicillin, we checked this out, a common antibiotic, and we sasaw, the prices come up. So, is that not good enough, doctor?
It's not good enough.
It's not good enough.
In your short 15-minute visit with me,
yeah.
What are the things you want to cover? And you're a healthy young woman. Mm-hmm. Imagine if you're an older diabetic with hypertension and high lipids. I mean, the list is this long. The visit is 15 to 20 minutes. Half an hour if I'm stretching it, which I always do, and drug prices often won't make the grade. My patient's on 7 drugs. How am I going to sit there and put it into a separate database? Imagine if it automatically came up. If it came up, I'll be saving that patient from having a heart attack. I'll be saving that patient from going on and having hypertension that's through the roof that winds her up in the emergency room. It has to change.
What is the next step? If, we're waiting on the ministry to do something about this, but what is the next step for you?
The next step for me would be seeing the ministry fund Ontario MD so that Ontario MD can simply integrate the drug costs of the Ontario drug benefits into the electronic medical record. And when that happens, it's a game changer. It's a game changer for physicians. It's a game changer for the universality of healthcare.
And millions of Canadians that obviously don't have drugs. Dr. Iris Garfinkel, thanks for your time today.
Thank you.